Hi everyone, my name is Dr. Sudit Ranade, and I'm the Medical Officer of Health for the County of Lambton. Today I'd like to talk to you about how we can get through the COVID-19 crisis together by moving from fear to learning to growth. I'd like to use a diagram that we found that was adapted by Dr. Monica Lange from other work that describes how people react to crises and critical situations. The first response to that crisis is fear. That's a normal, healthy response, and in this case with COVID-19, fear can be a great motivator to get us to do the things we need to do, like physical distancing. But over time, fear is an unhealthy, emotional response because it's not something that we can sustain. And so to build our response to COVID-19, we have to collectively move from fear to learning and into growth. If you're hoarding food or supplies like toilet paper, that might be an indicator that you're still persisting in a fear mode. If you're spreading fear or anger, if you find yourself being angry at other people for little things, then that's also an indicator that you might be harboring a lot of fear. If you find yourself complaining frequently, if you find yourself getting upset easily, or if you find yourself forwarding unverified information to others, just shooting off emails to everybody that you can think of to share information without checking into it first, those might be signs that you are still living in a fear-based environment, in a fearful response to COVID-19. And remember, now that we've been doing this for about 4 weeks, the fear-based response may no longer be that helpful to us. So my goal is to help you think about moving away from fear and into learning. So what does a learning response to COVID look like? According to this author, it involves things like this: not stressing about things you can't control, not consuming food, alcohol, news, and other harmful things compulsively or obsessively, being able to identify your own emotions, being aware of situations and thinking before you act, evaluating information and the sources that you use before you share them with others, and recognizing that everyone is trying to do their best. I believe that over the next couple of weeks, it is our job, our collective job, to move from a fear-based response to a learning-based response in order to make sure that we can help everyone in this community to get through COVID-19. Over time, I hope that we can move from learning to growth. And when we're in the growth zone, we think about others and offer to help. Many people are already doing this, and I'm very thankful to you. We identify skills that can be used to help others. We live in the present and we focus on the future. We're empathetic, thankful, and appreciative. We stay happy and hopeful. We adapt to changes. And we practice quiet peacefulness and mindfulness and patience. My goal is to move us from fear to learning. And how might we do that? I think one of the ways that we can do that is to acknowledge the fear that we have. It's okay to be afraid of this. It's okay to tell yourself you're afraid, and it's okay to talk to others about your fear. But then you need to take that fear, you need to put it into a little package and move it over to one side. And then you need to be curious. So think about a question that you might have about COVID-19 and see if you can answer it using a credible source of information, like Lambton Public Health's website, the Public Health Agency of Canada, or the CDC or the WHO. Once you've satisfied yourself that you have the answer to your question, think about something compassionate that you can do today for yourself, and think about something compassionate that you can do today for someone else. I believe if we can do these things, then over the next week or two, we're going to slowly move ourselves out of fear and into learning, where we can have the best possible response to this COVID crisis together.